As of mid-May 2026, international health agencies have transitioned into a state of heightened surveillance following a confirmed multi-country outbreak of the Andes hantavirus, a rare and highly lethal pathogen. The development has triggered a wave of coordinated public health responses across several continents, with particular focus on major European transit hubs. While hantaviruses are traditionally understood as zoonotic diseases, meaning they jump from animals to humans, this specific strain, originating in South America, is the only known variant capable of human-to-human transmission. This biological characteristic has fundamentally shifted the risk assessment for international travel, prompting health ministries to reactivate monitoring protocols that have remained largely dormant since the conclusion of previous global health emergencies. The current situation centers on the MV Hondius, a Dutch-flagged wildlife expedition vessel that departed from Ushuaia, Argentina, in late March. What began as an isolated illness on board has now evolved into a complex international contact tracing operation, involving passengers and crew from 23 different nations. The framing of this event by public health officials underscores a significant level of concern regarding the potential for secondary transmission in confined environments, specifically aircraft and airport terminals. Since the first reports emerged on May 2, 2026, the World Health Organization and the European Center for Disease Prevention and Control have been tracking a cluster that currently includes 11 cases. Of these, 8 are laboratory confirmed, 2 are classified as probable, and 1 remains inconclusive. Clinical severity is a primary driver of the current urgency. The outbreak has already resulted in 3 confirmed deaths, representing a case fatality ratio of approximately 27%. Officials note that hantavirus typically presents with a rapid progression from initial fever and gastrointestinal distress to severe respiratory failure or renal syndrome. In the context of the Andes strain, the threat is amplified by the fact that the virus can spread through close, prolonged contact, making the close quarters environment of a cruise ship or a long-haul flight a high-risk setting for viral shedding. Geography and timing are critical to understanding why this development is being treated with such gravity by border authorities. The virus was likely introduced to the ship during a shore excursion in South America, where the index case is believed to have acquired the infection. As the vessel moved from the South Atlantic toward the Canary Islands, the virus began to circulate among the 147 individuals on board. By the time the ship reached Cabo Verde and later Tenerife, symptomatic passengers had already begun disembarking and transiting through major airports. This has led to the activation of active surveillance measures in countries like Italy, where the Ministry of Health is currently monitoring travelers who shared flight segments with infected individuals. The time frame of the outbreak, stretching from late April into mid-May, means that many potentially exposed individuals are still within the 6-week incubation window, a period during which the virus can remain dormant before the sudden onset of life-threatening symptoms. This uncertainty is what has forced a return to stringent documentation and traveler tracking regimes at certain ports of entry. The core of the current developments lies in the aggressive response of national health agencies and the activation of emergency contingency plans at international borders. In Italy, the Ministry of Health has officially triggered active surveillance for passengers who transited through Rome's Fiumicino airport. This measure was specifically focused on individuals who traveled on a KLM flight segment from Johannesburg to Amsterdam, which included a passenger who later succumbed to the virus. Health authorities in the regions of Calabria, Campania, Tuscany, and Veneto have been instructed to conduct direct daily monitoring of these individuals for a full 42 days. This level of scrutiny reflects a broader European effort to utilize the revised passenger locator form platform, a digital infrastructure kept on standby for exactly this type of high-mortality pathogen event. While some reports have characterized these measures as a return to lockdown-style regimes, official statements from the ECDC and WHO maintain that the current risk to the general public remains very low. However, the language used by officials has notably shifted toward preparedness, with warnings that contingency protocols may be further tightened if secondary cases are detected within the general population. At the center of the operational response is the Tenerife South Airport, which has been designated as a primary hub for the management of the outbreak. From this location, coordinated medical evacuation flights have been dispatched, supported by the European Union's Health Task Force. These flights, co-funded by member states including France, the Netherlands, Greece, and Ireland, have been tasked with the safe repatriation of passengers under strict infection control conditions. Meanwhile, laboratory and clinical data are being funneled into the EU Reference Laboratory for Public Health, where scientists are working to sequence the specific viral strain. Preliminary sequencing suggests that the cases stem from a single zoonotic spillover event, but the high rate of transmission on the ship has led to intense investigation into whether this specific variant has developed any increased transmissibility. The current clinical management of patients involves high-level isolation and, in some severe cases, the use of extracorporeal membrane oxygenation, or ECMO, to support lung function as the virus attacks the respiratory system. The tension between verified data and public alarm is becoming a central theme of the reporting. Official data as of May 14 shows 4 patients remain hospitalized across Europe and South Africa, with 1 individual in intensive care in Johannesburg and others in the Netherlands and Switzerland. Public health agencies are carefully balancing their messaging, while they emphasize that hantavirus does not spread with the ease of a respiratory virus like influenza. The unique person-to-person capability of the Andes strain necessitates a level of caution not seen in years. This has led to the re-implementation of advanced passenger information requirements for airlines, which must now keep seat manifests and contact data for extended periods. Shipping and travel risk professionals are also being advised to review their duty of care frameworks, as the threat of localized quarantines remains a tool that authorities are prepared to use if the contact tracing efforts fail to contain the cluster. The lack of a widely available vaccine for hantavirus further complicates the response, leaving isolation and surveillance as the primary weapons in the current public health arsenal. Prevention and surveillance now form the front line of the global response to the Andes hantavirus cluster. Public health guidance issued by the ECDC and the CDC focuses on 2 distinct areas: managing the immediate risk to those who may have been exposed and educating the general public on the long-term risks associated with rodent reservoirs. For the individuals currently under monitoring, the guidance is clear: strict self-quarantine and immediate reporting of symptoms such as fever, muscle aches, or sudden shortness of breath, because the virus is often transmitted through aerosolized particles, traditionally from rodent waste, but in this case, potentially through close human proximity. Airborne precautions are being applied during medical procedures. For the broader public, health officials emphasize that standard hygiene practices, such as frequent hand washing and avoiding contact with rodents or contaminated environments, remain the most effective defenses. In rural areas where hantavirus is endemic, the cleaning of enclosed spaces like sheds or storage units is identified as a high-risk activity, requiring the use of disinfectants and, in some cases, specialized respiratory protection to avoid inhaling dust that might carry the virus. Despite the intensity of the current surveillance, there are significant limits to what is known about this specific outbreak. The exact mechanism that allowed the virus to spread so effectively among the passengers of the MV Hondius is still under investigation. Scientists are looking into the ventilation systems of the ship and the duration of contact between the confirmed cases to determine if environmental factors played a larger role than biological mutation. There is also the persistent challenge of the long incubation period, which can last up to 6 weeks. This creates a lag in data, meaning that health officials may not know the full extent of the transmission for several more weeks. This inherent delay is why the WHO and ECDC have been hesitant to lift the heightened surveillance status, even as they reassure the public that a large-scale pandemic is unlikely. The current assessment remains low risk for the general population, but high alert for those involved in the logistics of international travel and border control. As the international community moves forward, The focus remains on early detection and the rapid exchange of information through established networks like the EU's Early Warning and Response System. The incident serves as a live test of the pandemic preparedness plans developed over the last several years, highlighting both the speed of modern digital contact tracing and the persistent vulnerabilities inherent in global travel. For now, the focus is on containment, and the hope that the current cluster of 11 cases represents the peak of the event rather than the beginning of a wider trend. Authorities continue to urge travelers to retain their boarding passes and travel documents for at least 30 days, ensuring they can be reached should further exposure links be identified. The situation is a stark reminder of the complexities of modern virology, where a single encounter on the other side of the world can trigger a massive health response across multiple continents. For regular updates on this and other developing public health stories, consider subscribing to our reports. The clinical and logistical center of this outbreak has shifted from the MV Hondius to advanced biocontainment units and intensive care wards across several continents. As of mid-May 2026, the medical community is closely monitoring a 65-year-old French woman who remains in critical condition in a Paris intensive care unit. Her case represents the most severe manifestation of hantavirus pulmonary syndrome observed in this cluster, requiring the use of extracorporeal membrane oxygenation, or ECMO. This life support technology effectively functions as an artificial lung, oxygenating the patient's blood outside the body to allow the viral-damaged lungs to recover. Similarly, in Johannesburg, South Africa, another passenger remains in intensive care following laboratory confirmation of the Andes virus on May 2nd. In the United States, a retired oncologist who had been a passenger on the vessel is currently being held in a specialized biocontainment facility in Nebraska. The physician had stepped in to assist the ship's medical team as the illness began to spread among the 147 individuals on board. Although he initially tested only faintly positive, federal authorities moved him to the high-security unit as a precaution. Highlighting the extreme level of caution surrounding the Andes strain's potential for human-to-human transmission, the logistical response to the outbreak has triggered what some observers describe as the most restrictive airport protocols since the previous decade. On May 10, the MV Hondius arrived at the port of Granadilla in Tenerife, Canary Islands, which served as the primary staging ground for a mass repatriation effort. Under the supervision of the Spanish health authorities and an expert team from the EU Health Task Force, passengers were disembarked and channeled into coordinated evacuation flights. These flights, supported by nations including Greece, Ireland, and Canada, were managed under strict infection prevention and control measures to prevent any potential environmental contamination during transit. A significant portion of the current surveillance effort is now focused on secondary contacts, particularly those who traveled on a KLM flight segment from Johannesburg to Amsterdam. The Italian Ministry of Health has directed health departments in Calabria, Campania, Tuscany, and Veneto to initiate direct daily monitoring of passengers from that flight who have since entered Italy. These individuals are required to undergo a 42-day observation period, with Day 0 officially established as May 10, the date of disembarkation for many of the high-risk contacts, while headlines have frequently used the term lockdown to describe these measures. Official statements from the European Center for Disease Prevention and Control and the World Health Organization suggest a more targeted approach. The ECDC has classified all individuals who remained on the ship as high-risk contacts, necessitating self-quarantine and daily symptom checks. However, the agency maintains that for the general population in the EU and EEA, the risk remains very low. Scientific developments in the lab are beginning to provide a clearer picture of the virus's origins. Preliminary sequencing of the Andes hantavirus samples conducted at the EU reference laboratory suggests that the cases likely stem from a single zoonotic spillover event that occurred shortly before the ship departed Argentina in early April. The working hypothesis is that the index case was exposed to rodent-contaminated dust or waste during a shore excursion in South America, after which the virus circulated within the close confines of the vessel. Investigators are currently examining whether the ship's doctor, who was himself evacuated to the Netherlands on May 6, and other crew members were exposed through caregiving or through shared ventilation systems. Testing and surveillance protocols have been expanded to meet the 6-week incubation window characteristic of the Andes strain. Laboratory investigations are ongoing to rule out any mutations that might indicate increased transmissibility, though current data shows no such signs. In the United States, the CDC has elevated its response to Level 3 emergency status, focusing on the safe monitoring of American passengers repatriated from the Canary Islands. The agency's Health Alert Network has issued guidance to clinicians nationwide to include hantavirus in differential diagnoses for any patient presenting with severe respiratory distress and a history of recent travel to the South Atlantic or contact with known passengers. As of May 13, the official count stands at 11 cases, 9 laboratory confirmed and 2 probable, with the possibility of more appearing as the 42-day monitoring window continues. The ship itself has departed Tenerife for a deep cleaning facility in Rotterdam, carrying only a skeleton crew of 25 under the supervision of Dutch health workers. This transition marks the end of the maritime phase of the crisis and the beginning of a complex, multi-jurisdictional public health monitoring effort that remains one of the highest priorities for international border agencies. As the international public health community shifts its focus toward long-term containment, the primary defense against the Andes hantavirus remains a combination of rigorous surveillance and specific preventative behaviors. Unlike many other viral threats, hantavirus is not spread through catch-cell social contact or common vectors like mosquitoes. Instead, the mechanism of infection is largely centered on the aerosolization of viral particles. In nature, the Andes strain is carried by the long-tailed pygmy rice rat, a rodent native to the forests and grasslands of South America. The virus is shed in the animal's urine, droppings, and saliva. When these materials dry, they can become airborne dust. Humans typically become infected by inhaling these microscopic particles, a process that can occur during the cleaning of infested cabins, sheds, or, as suspected in the case of the MV Hondius, during excursions into endemic rural environments. For the general public, the most critical practical takeaway is the avoidance of creating dust in areas where rodents may be present. Public health agencies advise against sweeping or vacuuming potentially contaminated areas. Instead, surfaces should be thoroughly soaked with a disinfectant solution, such as 1 part bleach to 9 parts water, before being wiped down with damp cloths. The unique challenge of the Andes strain is its documented capacity for person-to-person transmission, which necessitates a different layer of public health guidance compared to North American hantavirus variants. Current surveillance protocols are heavily reliant on the advanced passenger information and passenger locator form systems that were refined during previous global health emergencies. These digital frameworks allow health ministries to trace the movement of every individual who shared an enclosed space with a confirmed case, such as an airplane cabin or a ship's dining hall. For those identified as high-risk contacts, the guidance remains a strict 42-day monitoring period. This extended time frame is a direct result of the virus's biological behavior. Hantavirus has an unusually long and variable incubation period, often ranging from 1 to 6 weeks. During this window, an infected individual may feel entirely healthy while the virus silently replicates, leading to a sudden and catastrophic onset of symptoms. Officials emphasize that anyone under surveillance who develops even a mild fever should seek immediate medical attention at a facility equipped with high-level biocontainment capabilities, as early supportive care is the only known way to reduce the mortality rate. The limits of medical knowledge regarding hantavirus present a significant hurdle for public health officials. Currently, there is no widely approved vaccine for the Andes strain, nor is there a specific antiviral treatment that has been proven universally effective. While some clinicians have utilized the drug ribavirin in experimental settings, its efficacy remains a subject of ongoing study and debate within the virology community. Consequently, the medical response is almost entirely focused on supportive therapy, which includes the use of ventilators and ECMO to manage respiratory failure. This lack of a silver bullet treatment is precisely why authorities have resorted to more traditional, Non-pharmaceutical interventions. The return of mask mandates in specific transit corridors, such as Tenerife South and Rome Fiumicino, is not a reflection of a general airborne threat to the public, but a targeted precautionary measure to minimize the risk of secondary clusters in high-density areas. These mandates are designed to act as a buffer, while contact tracers work through the backlog of passenger manifests, ensuring that any undiagnosed shedding of the virus is physically contained, ethically. The current situation forces a difficult balance between the preservation of individual liberties and the mandate to protect global health. The reimposition of travel restrictions and mandatory monitoring regimes often triggers public anxiety, yet health officials argue that the high lethality of hantavirus, with fatality rates often exceeding 30%, justifies these temporary incursions. The objective is to prevent the virus from establishing a foothold in regions where it is not endemic. As of May 15, 2026, the success of this containment effort depends on the transparent sharing of data between nations and the cooperation of the 147 individuals who were aboard the MV Hondius. While the immediate crisis on the vessel has been resolved through disembarkation and deep cleaning, the tail of the outbreak will be long. The next 4 weeks will be a critical period of observation as the final groups of travelers clear their 42-day windows. Until then, the global surveillance network remains on high alert, watching for the first signs of a secondary wave that has not yet materialized. It is a moment of cautious optimism, tempered by the stark reality of the virus's clinical severity. For continued factual reporting on global health developments and emerging viral threats, please consider subscribing to our channel.